Health Canada has approved Pradax, the first new treatment in 20 years for the prevention of stroke in Canadians with atrial fibrillation, or AF, a common but serious heart condition that affects 250,000 Canadians. Dr. Stuart Connolly, director of the Division of Cardiology at the Population Health Research Institute at McMaster University in Hamilton, says the availability of Pradax will fundamentally change the way we treat and manage patients at risk of stroke.
Our current treatment for stroke, warfarin, is effective but is difficult to use and has complications. Now that we have dabigatran, we have a safer, more effective, and easier to use treatment that's going to save thousands of lives.
Atrial fibrillation is an irregular heart rhythm that can cause the heart to beat very fast. After the age of 55, the incidence of AF doubles with each decade of life, and after the age of 60, 1/3 of all strokes are caused by AF. Mr. Adrian Van Halderen suffers from AF and knows firsthand the burden of the disease.
When I turned 65, the doctor urgently recommended the use of some form of blood thinner to prevent against strokes. The risk of stroke increases as I'm aging, and he felt it imperative to continue on a blood thinner. He put me in the study of Pradax, and I felt confident about my situation ever since, and I've had no restrictions on my behavior or life.
Pradax is an oral anticoagulant that differs from the current standard treatment, warfarin.
Well, most patients with atrial fibrillation need to be on some form of blood thinner to reduce the risk of stroke, but many are not because the current blood thinner, warfarin, is so difficult to use and so problematic. Now that we have dabigatran, these patients are likely going to get on an effective blood thinner, and this is going to have a huge impact, reducing their risk of stroke.
Dr. Connolly adds that stroke takes its toll on the patient, their family, and the economy too. Strokes due to AF tend to be more severe and can cause greater disability. If you have AF, speak to your doctor about new treatment options to help reduce your risk of stroke.